the wonderful Dr. Sinead, Pharmacist Sinead, who's going to present us on our anticoagulation medication. Really important that we understand what we're taking. They're big tablets that we're taking. They anticoagulate us, so we need to know what to do if you miss one. What do you do if you need to come off it for surgery, stuff like that. So ask any questions you need to as well while you're here.
Yep,
Thanks.
Perfect. Thanks, Anne-Marie. Hi everyone. So as Anne-Marie said, Sinead O'Mahony is my name. I'm a pharmacist in Vincent's University Hospital. So I'm just going to talk a little bit about anticoagulation medication today, which is a very broad topic, but as much as I can fit in anyway. So anticoagulants, so the medicines, they're kind of categorized so that you have injectable anticoagulants like heparin or Clexane or Inohep. Then you also have anticoagulants that you can take orally, so tablets or capsules like warfarin or the DOACs like Eliquis, Pradaxa, Lixiana and Xarelto. So I'm going to give a little bit of an introduction first on how the medicines work, and then my focus today is going to be on the oral anticoagulants. So firstly, just as an introduction, so coagulation or blood clotting is the process by which the body forms a thrombus or a clot. So when an injury occurs to a blood vessel, this is an important process because it prevents excessive bleeding from happening. And how it works is there's a collection of cells in the blood called platelets and proteins in the blood. So they work together to stop any bleeding by forming a clot over the injured blood vessel. So these proteins are called coagulation factors, and they're activated one after the other in this kind of cascade effect. So then at the end of the cascade, you have this fibrin, this protein formed. So this fibrin forms a mesh, and this mesh becomes the thrombus or the clot. So this protects the vessel so that it can start to heal, and then typically your body will naturally dissolve the blood clot after the injury is healed. So that's when things are working normally. However, this process can be inappropriately activated. So the body starts to make blood clots in blood vessels where there is no injury, and this can be problematic. So these kind of clots usually form in the veins, and part of the clot can then break off and travel through the blood system to the lungs, leading to pulmonary embolism, which can be life-threatening. So anticoagulants are medicines that were designed specifically to interfere with this process of coagulation or blood clotting. So the aim is to block the production of this fibrin protein. So different anticoagulants have different targets in this process, but as you can see, they all lead to the same end result. So anticoagulants are sometimes called blood thinners. They do not actually dissolve the clot. They rather prevent new clots from forming. They also help prevent existing clots from growing or moving through the blood system. So when you're then on an anticoagulant treatment, existing clots will usually eventually dissolve and disappear over time. Sometimes the question comes up, well, what about aspirin? So aspirin is an antiplatelet drug, a family that also includes, you might have heard of Plavix or Prasugrel or Ticagrelor. So these are also sometimes referred to as blood thinners. So both aspirin and anticoagulants slow the blood clotting process, but they do so in different ways. So antiplatelets stop these cells called platelets in the blood from sticking together. So because they work differently, aspirin and anticoagulants are used to treat different conditions. So our focus is on anticoagulants, which are used to prevent or treat venous thromboembolism. And venous thromboembolism is a term that includes deep vein thrombosis or DVT or pulmonary embolism or PE. It's not our focus here, but in controlling the blood clotting, anticoagulants are also taken by patients with atrial fibrillation. So this is a type of irregular heartbeat or arrhythmia. So taking an anticoagulant when you have atrial fibrillation can reduce the likelihood of it causing a stroke by preventing clots from forming. So this just to highlight that as well as PE and DVT, anticoagulants are also used for different indications. So now that we know a little bit about how anticoagulants work and why you might need to take one, the next question would be, which anticoagulant are you started on? So there's a number of factors that might decide which one is chosen. So which option has been proven to be effective for the specific condition that we want to treat. Kidney or renal impairment, where the kidneys aren't functioning as well as they could be a factor. For example, you can take apixaban in much more severe renal impairment than you could take dabigatran. Whether you have a history of stomach ulcers, patient monitoring, so would a person be able to attend GP or a clinic so that regular blood tests could be taken for the monitoring of warfarin. It might depend on what other medicines you're taking for other conditions. So for example, certain medicines for epilepsy can affect how well Eliquis can work. Swallowing difficulties, so some options can be crushed if necessary, but others can't. Patient weight, so weight can be a factor in deciding the dose that's used, but it can also be a factor in the choice of anticoagulant. So for example, if a patient was 190 kilos, it'd usually be more appropriate to use an injectable version rather than an oral tablet. Some of the choices are once a day, while others are taken twice a day, which could be a factor in your choice. Also, whether there's an antidote available, so if there's something that can reverse the action of the medicine. So this is just to highlight that it's not one size fits all. There's a lot of considerations in choosing which will be the most suitable anticoagulant. So now I'm just going to focus a little bit firstly on warfarin and then the DOACs, or direct oral anticoagulants, which were previously called NOACs, but now more commonly referred to as DOACs. So warfarin firstly was around long before any of the DOACs. So it's a once a day tablet, approximately the same time every day. Warfarin dose is individualized based on the result of a blood test. So what's measured in this blood test is your INR, which stands for International Normalized Ratio. So it's basically a measure of how long it takes the blood to clot. So the longer your blood takes to clot, the higher the INR. If your INR is too high, then there is an increased risk of bleeding, need to reduce the warfarin dose. If your INR is too low, then on the other hand, the warfarin might not be effective in preventing the clots from forming, so we need to increase the warfarin dose. So there's a certain amount of tweaking for each individual person to get the right warfarin dose to keep this INR within your recommended range. So with the warfarin, it comes as two different brands. There's the Warfront brand or the Warfarin brand, and the recommendation is to try and use the same brand consistently. So in both cases, the 1 milligram tablets are brown, the 3 milligram tablets are blue, and the 5 milligram tablets are pink. With warfarin, it can be prone to interactions. So with medicines, with other medicines you might be taking, also with diet. So if you're starting or stopping another medicine while you're taking warfarin, you might need more frequent blood tests. So for example, clarithromycin or Clasid is a very common antibiotic, and that can affect your INR. So often it can elevate your INR. So while you're on the Clasid, it might be necessary to reduce your warfarin dose. So as well as medicines, warfarin can also interact with diet. So that's also a consideration. So it's foods that contain vitamin K that can affect your INR. So these would be like Brussels sprouts, cabbage, lettuce, spinach, which have the potential to interact with the warfarin. Cranberry juice isn't recommended to take, but usually with these foods that have the potential to interact, the recommendation is that consistency is key. So just having a consistent amount of them on a weekly basis and avoiding drastic changes. Alcohol can also be a factor. So it can be dangerous to binge drink while on warfarin. Also, of course, if you sustain an injury, you might suffer from more significant bruising, which potentially could take longer to recover. So then moving on from warfarin onto the DOACs, or the direct oral anticoagulants. So the first one is, so apixaban is the drug name and Eliquis is the brand name. So it's a twice a day tablet, so morning time and evening time. You take the Eliquis with or without food, it doesn't really make a difference. When treating a DVT or PE, it's a higher dose usually for the first week, and then after that 5 milligrams twice a day. In cases where ongoing prevention is required longer than 6 months, sometimes the dose might be reduced to 2.5 milligrams twice a day. Rivaroxaban or Xarelto is a once-a-day tablet. So with Xarelto, which isn't the case with the other DOACs, it's important to take it with food. So you get much more benefit if you take the Xarelto at the same time as your meal. So again, with this one, it's a higher dose for the first 3 weeks, and then it's reduced to once a day after that. And also with the Xarelto, if usage is going on for prevention after longer than 6 months, sometimes a dose reduction is recommended. Edoxaban or Lixiana, again, is a once a day tablet. So usually when starting Lixiana for treating a DVT or PE, we'd give 5 days of an injectable anticoagulant first before starting. So 60 milligrams once a day is the usual dose. If you're less than 60 kilograms, or if your renal function isn't, is a little bit reduced, or if you're taking certain medicines that can interact with it, then it's reduced to a dose of 30 milligrams. And then the last one is dabigatran or Pradaxa. So that's a twice a day tablet as well. With or without food doesn't really matter. The thing with Pradaxa is the capsules have to be kept in the original packaging. So if you're getting a blister pack of your medicines made up from the pharmacy, they wouldn't include the Pradaxa because they don't recommend popping them out of the original packaging. Similar to the Lixiana, it's when starting treatment, you're getting the injectable anticoagulant first before switching to the Pradaxa. And again, 150 milligrams twice a day is the usual dose, but there are some factors that you might need to reduce this dose. So again, it can depend on your age, how your kidneys are functioning, and then other interacting medicines or particular patient history. So with these medicines where the dose is affected by your kidney function, it's important to have, as recommended by your GP, like blood tests to check that the dose is still appropriate for how your kidneys are functioning. So all medicines have side effects, but not everyone will, experience them. So with anticoagulants, the side effect to keep in mind is, or that could be expected, might be unexpected bruising or bleeding. So signs that would, prompt you to seek medical attention as soon as possible might include, so if you encounter nosebleeds lasting longer than 10 minutes, blood when you go to the toilet, like in your urine or in your stools, coughing or vomiting blood, unusual or severe headache, unexplained or severe bruising. Then if you're unable to stop this bleeding, or if there's a significant head injury or trauma, to go to the emergency department, but to tell the doctor or nurse immediately that you're taking an anticoagulant. So just some general points to cover when thinking about anticoagulant medicines. So how long will I take it for? So this varies on a case-by-case basis. Sometimes it might be 3 months, sometimes it might be longer, or occasionally it might be indefinitely that an anticoagulant is required. So you should be advised of this from your clinic or your GP. So oftentimes the duration might depend on what's suspected to have caused the VTE, so whether these risk factors still exist or not. But it's not advisable to stop taking an anticoagulant without getting a doctor's advice. Missed doses. So it's important to try and avoid missed doses if at all possible. Not to sound old pharmacist preachy, but a medicine can't work if you don't take it, is what we usually say. So if you find that you're struggling to remember to take the medicine, maybe to set an alarm on your phone, or asking a family member to remind you, or putting it somewhere around the house that would trigger you to remember to take it every day. Another point to cover with anticoagulants is to inform your dentist or your doctor if you're taking an anticoagulant and you're having any surgical or dental procedures. So let them know when it's being planned, and again before the actual procedure. So they might want to hold the anticoagulant for a short period of time. So usually whether it's held or not depends on the bleeding risk that's associated with the procedure that you're going for. So you'll need to tell them what you're taking and also the dose of the anticoagulant that you're taking. So for any appointments like this, or anyway, just in case you're ever admitted to hospital, it's a good idea just to keep an up-to-date list of all your medicines, not just your anticoagulants, so you know exactly what you're taking. So on the HSE website, or you'd often find these leaflets in GP surgeries or pharmacies, you can just have a list of what you're taking and the dose and your frequency, so that there's no confusion if you're admitted to hospital or before any of these appointments. It's a good idea. Pregnancy and breastfeeding is something else to mention. So you should avoid pregnancy while taking a DOAC, but if you get pregnant or are thinking of getting pregnant, not to stop taking the DOAC, but to inform your medical team as soon as possible so that a plan can be made around treatment options, and the same advice applies to breastfeeding. So I spoke a little bit about interactions with warfarin and how doses might need to be adjusted based on your INR, but drug interactions would also need to be considered with the DOACs. So before you start any new medicines, so not just prescription medicines, but things that you could buy over the counter or herbal supplements, it's important to check that they're safe to take with the medicines you're already taking. So when we talk about drug interactions, it's kind of two main categories that we're thinking of. So the first case is when you take two medicines that can have the risk of the same kind of side effects. So for example, aspirin and anti-inflammatory medicines like ibuprofen, they have a risk of gastrointestinal bleeding. Then DOACs would also have a risk of bleeding. So when you're taking these two medicines which both have a risk, you're increasing the overall risk. So the recommendation is to avoid taking aspirin or aspirin-containing medicines unless they're prescribed by a doctor who knows you're taking an anticoagulant. As I said, when you're buying things over the counter, just to consider, ask the pharmacist to check that it's safe to take, because I've just included an example here, which is Excedrin, which is a tablet that's marketed for migraine or headache, but it actually contains a few different ingredients. So there's paracetamol and caffeine in it, but there's also aspirin in the tablet. So it's just something to keep in mind if you're buying something or starting a new medicine. So that's where you have the potential of increased risk of side effects. Also, interactions can occur with medicines which the other medicine might reduce the effect of your anticoagulant or increase the effect of your anticoagulant. So some antibiotics can interact with your DOACs, or some medicines you might take for epilepsy can affect your DOACs. So as an example, I've just included a herbal medicine that is available in Holland and Barrett. So this is called St. John's wort. So just because it's seen as a natural remedy doesn't necessarily mean that it's harmless. So with this particular case, so this St. John's wort it speeds up the breakdown and the removal of the apixaban from the body. So you wouldn't get the full effect of your dose, which of course could have consequences if it can't work properly. So it's just to have in the back of your mind if you're starting any new medicine to check that it's safe with what you're taking already. There's some information leaflets outside and on the website as well. It's great information about the DOACs and warfarin and different videos on different things. So it's worth checking that out. Or there should be a patient information leaflet in any of the packs of medicine that you collect from the pharmacy, or to ask your pharmacist if you have any queries. I used a few different references, and one of my colleagues in St. Vincent's had given this talk previously, so my thanks to her. If any questions, I'd welcome questions, or else I'll be buzzing around for the afternoon if you think of anything.
Not really a question, sorry.
Yeah.
A few months